Today we will be conducting an integumentary system assessment on a nonverbal pediatric patient. When assessing this type of patient, the parent should always be present to act as an advocate and voice for the patient. Additionally, when assessing the nonverbal child's integument, you should also make note of any signs of physical abuse. These include, but are not limited to, a large number of bruises in different stages of healing, any suspicious burns, or any marks on the skin that look like a hand. We must first assess our patient's integumentary system for any distinguishing odors, discolorations, skin breakdown, or lesioning. As the patient is in a diaper, we can readily inspect much of his skin. We can see his arms, his legs, his back and his front, and I can already tell that there's no lesioning beyond the simple scrapes and superficial abrasions of childhood play. The child's odor is that of soap, and his skin is hale and healthy. To check for skin breakdown in the diapered patient, we should check inside the diaper both in the front and in the back. If I can check his front, please. Again, it's important to have the parent present when performing these inspections. We can also quickly palpate the patient's skin for any lesions, overall texture, temperature, thickness, and edema. Once again, there are no lesions on this patient's skin beyond the abrasions of childhood play. The skin itself has a smooth texture, is healthfully thick, and is appropriately warm. There is no swelling noted either upon palpation. Next, we need to inspect the patient's scalp and hair. We want to assess the hair for its color, its amount, its distribution, as well as its general thickness, oiliness, and any lesioning or parasites. So, looking at this patient's head, we see an even distribution of blonde hair of appropriate amount. It appears minimally oily, and there are no visible lesions or parasites in the hair or along the scalp. We also need to palpate that thickness to confirm what we've inspected. And the hair does appear appropriately thick for his developmental state. The hair itself is fine, but he's got a lot of it. And upon palpation, the hair is minimally oily. There are no palpable lesions on the scalp, and there are no palpable parasites either. Next, we need to inspect our patient's nails. When assessing the patient's nails, on the fingers and toes, you should look for overall grooming and cleanliness, as well as the color and shape of the nails themselves. The patient's nails are closely trimmed and clean. They are pink, and they are of the appropriate shape. There's no clubbing or malformation noted upon inspection. We also need to palpate the nails for consistency of texture, as well as for capillary refill. Small children may be somewhat resistant as they experience the world through their hands and feet. They may also be very ticklish. This patient's nails are of a smooth texture consistently across the hands and feet. The nails are noticeably thin, which is appropriate to his age development. And his capillary refill is less than 3 seconds. This has been our integumentary assessment of the nonverbal pediatric patient.